Oklahomans across the state are working to make our state a healthier place to live, work, and play. In urban centers and rural communities alike, city leaders, businesses, and schools are making properties tobacco-free and embracing wellness policies to encourage Oklahomans to eat better, move more, and be tobacco-free.
For the past 7 years, the Jackson County Tobacco Education Committee has been working diligently at trying to change the norm of tobacco use. And I think we've done a pretty good job of that. At this time, every school inside Jackson County is a 24/7 tobacco-free school. I love the fact that we're out here trying to stop something that I know is causing health risks and health effects, and I think it's great that we have the opportunity to go and tell our kids of something that's dangerous. They need to understand that the tobacco companies are actually focusing in on them as the new customer, and we hope that in the future to change that.
While our work primarily focuses on prevention, TSET grants also bring groundbreaking treatments to Oklahoma cancer patients and recruit primary care physicians to rural, medically underserved parts of our state.
The bottom line is TSET and the Stevenson Cancer Center have partnered together to create a world-class research infrastructure where we can recruit basic scientists and clinical scientists that will address the fundamental problem of cancer here in the state of Oklahoma and nationwide.
Our relationship with TSET and the funding that they have provided our clinical trials operation has leveled the playing field so that all Oklahomans with cancer can get access to excellent clinical care, excellent research opportunities, the newest and best treatments.
Because of funds that have been allocated from TSET, without a doubt there is a level of research that could not have taken place regarding the public's health that not only can benefit the citizens of Oklahoma but also the United States.
We also invest in Oklahoma with incentive grants for communities and schools and have committed $45 million to research efforts. The Oklahoma Tobacco Settlement Endowment Trust is working to reduce our state's leading causes of preventable death, cancer, and cardiovascular disease by addressing tobacco use and obesity.
So one really unique feature and opportunity for us that we're so happy to have is the support and backing of TSET and the Shape Your Future initiative. One great example is the lighting of the walking trail on the east side of this park, actually, that goes from Ferris to Lake Helen, where it's so hot during the day. People are usually here early in the mornings or late in the evenings, and they need lights on the trail so they can walk in cooler weather. And TSET actually funded that as part of the incentive grants for certified healthy communities. And so we're working every day to try to increase the certification for not only Lawton, but other communities in Comanche County and schools, campuses. Anyone and everyone can play a part and play a role in creating a healthy community.
There are 152 parks that are covered by the Oklahoma City Tobacco-Free Parks policy. By having tobacco-free parks, Oklahoma City is making a stand and saying, we want to have a better, healthy environment for our families and our youth and just any individual who wants to utilize those facilities. And so by having that standard set that tobacco is not allowed, it's going to continue on in future generations and it's going to become a norm for them.
We are at Cameron University, which is a 24/7 no tobacco use campus. I think what the benefits of being a tobacco-free campus is right now the tobacco industry is really targeting, they're very much focused on that 18 to 24-year-old group. And so if we could make sure that the campuses, that you don't allow tobacco on the campus, they don't accept tobacco money for any of their research. So if we can have that policy in effect, it changes what's acceptable. And those students then aren't exposed. And hopefully, they'll be able to get through that 18 to 24-year-old without ever picking up that habit.
With Millwood School District, we were able to pass a complete policy by working with them. And a complete policy includes physical activity policy as well as nutrition policy. And so we got that complete policy passed while working with them. and we're very, very proud of them for being able to pass this policy.
Our school board adopted a policy that actually kind of dramatically changed the way that we look at nutrition and the way that we look at health education in our schools. And so as a result of that, we are beginning to implement that policy and work with teachers and families to support the implementation of that policy. It's absolutely a partnership because the raising of children is a partnership. It's not just the job of the school, it's the job of the families, it's the job of the communities. And so when kids, get this message from all different angles, then they start to make better choices about the things that they need to do.
Through TSET supported work and the support of many partners across the state, smoking in Oklahoma is at an historic low. Youth smoking has been cut in half, and 2/3 of Oklahoma's public school students attend a tobacco-free school. Since its inception, TSET has been a consistent force for change. We continue to advance our mission by helping all Oklahomans live better lives through better health.
Hi, I'm Tracy Strader, the Executive Director of TSET, the Oklahoma Tobacco Settlement Endowment Trust. Thank you for your interest in partnering with us to create a healthier Oklahoma. As we celebrate the 15th anniversary of TSET's creation, it's only fitting that we're launching this new TSET Healthy Living program today. The TSET Board of Directors has designated up to $22 million per year for 5 years for these community grants to help make the healthy choice the easy choice, where we live, work, learn, and play. TSET's strategic plan focuses on improving health by reducing cancer and cardiovascular disease, our state's leading causes of death. At TSET, we do this by addressing the health behaviors that lead to cancer and cardiovascular disease: tobacco use, physical inactivity, poor nutrition, and obesity. Over the last 10 years, we've funded local efforts to reduce tobacco use, and in more recent years, we've addressed physical activity and nutrition. As a result of these and other efforts, Oklahoma's smoking rates have reached a historic low, and our obesity rates have begun to slow and even decline. Through these programs, we've learned a great deal about the power of local people to create local solutions to improve the health of their communities. We've also sought input from current grantees and other stakeholders, as well as expert advice on the best and promising approaches to help us achieve our goals. As a result, this RFP attempts to honor the unique characteristics and culture of each community and provides a great deal of flexibility in terms of how communities achieve the outcomes of the program. The program will be focused on businesses, schools, community organizations, cities and governments, and we may fund one or more organizations in each community to accomplish the outcomes in each area. The fact is, TSET is only able to accomplish its goals and mission because of strong partnerships with passionate, dedicated individuals, organizations, and associations. Thank you again for your interest in the TSET Healthy Living program and advancing the health of Oklahoma. Together we can achieve better lives through better health.
Hello and welcome. My name is Kim McCoy. I direct grants management here at TSET, and I think I safely speak for the entire staff when I say we really appreciate your efforts in taking the time to view the information about the RFP. We are very excited about the new TSET Healthy Living program and want to make your application experience as comfortable, as painless as possible. I believe I echo the sentiments of our Executive Director, Tracy Strader, when I say we have worked very hard to streamline our approach. We have condensed the RFP, the master document itself, and we hope you find it to be consumer friendly. We are here to help, and that's the most important message I have today to share with you. If you would like to, you can grab a copy of the RFP as you view this information and use it as a touchstone of sorts, because I will be going through it and following the format and the order of the information relatively closely, so that may be of help to you. The first thing I would like to discuss with prospective applicants in terms of packaging a request is the letter of intent. It's very important to note that it is not required but we have made the process of submitting one as user-friendly as possible. It's a web form accessible through Smartsheet. The link is actually in the RFP, and applicants or prospective applicants completing the LOI do not have to register or be licensed users of Smartsheet to complete the letter of intent. The reason that we like it when prospective applicants complete the letter of intent and submit it is it gives us very important information to help guide and further refine the external review process. So we would appreciate submission of that. The deadline for submitting your letter of intent through Smartsheet is January 30th at 4 p.m. In discussing eligibility requirements, I would just like to hit the high points a little bit. Who can apply? Any private, nonprofit, or public entity with an administrative presence in the state of Oklahoma. We could expound a lot further on that. If you have a question specific to what constitutes administrative presence, please submit that using the protocol listed in the RFP, and we will address that, publish it so that all prospective applicants have access to that information. Tribal nations are eligible. There will be some post-award paperwork for tribal nations to complete. That is specified or detailed, described, and explained in the RFP itself. In addition, applicants will be required to have tobacco-free policies and to document that in the body of their request. Subcontracting is acceptable. There's information in the RFP detailing that. And applicants from the same service area will be required to discuss their intention to work together and how they are going to accomplish that. It is also important to note that every grant at TSET, as related to this particular initiative, there is an element of required evaluation, and there is a section of the RFP that provides additional detail about that. The available funding and grant period section in the RFP talks about the grant period as 5 years, with the program beginning at the advent of fiscal year 16 or July 1, 2015. There is an appendix that details the available funding according to population and service area. You will use that to define your requested amount, and it is important to note that we have asked you on what we are calling the cover page and solicitation request to define your anticipated request years 1 through 5. So use the funding table to do that. Every good applicant wants to know information about how to put a great budget together, so I'm going to provide you with some high points about how to do that. All awards with all grant makers are always contingent upon available funding, but it's important to say that. There is a planning phase with this particular program, and it is fluid. By that I mean it's going to be a 6 to 12 month planning period, and that will be, of course, decided contingent upon work done by the applicant in the first 6 to 12 months. All applicants need to carefully consider staffing needs. How many staff do you need? How will you address staffing to meet the goals outlined in the RFP? There is an actual resource document that should help guide that part of your budget request. It's resource document 2. Take a look at that. I hope it's helpful to you. There's also a cap on out-of-state travel. Please review information about the budget carefully with regard to travel. Applicants are allowed 10% of the total grant award for what we call a flat administrative charge. So that does not have to be justified or detailed out. When budgeting, please take a look at the health communications section of the RFP. There are several important bullet points that each applicant will need to be familiar with in order to create a firm budget. There is also a list of exclusions in the RFP. Be sure that you review those carefully, because the last thing, of course, that we want to see is that you have included in your budget an unallowable or disallowable expense. Okay, we are going to get to talking about actually packaging your request as a whole. Obviously, we need to talk about the deadline. The deadline for submission of all applications in response to the RFP is going to be February 23rd at 4 o'clock. All applicants will receive a receipt generated through Smartsheet. Again, registration to Smartsheet or having a license for Smartsheet is not necessary to submit a request. There is a link in the body of the document you will use. I strongly encourage every prospective applicant organization to approach packaging the request by reading the RFP and all related documents first. Organize your approach, get those out. I often used in my previous professional life pen and paper to organize my approach, and I strongly encourage everyone to start early. I think that's of fundamental importance anytime you try to pen a response to an RFP. Number your pages. There is more information about that. That may seem ridiculously picky. However, for our use and the use of external reviewers, we need you to number the pages and use the information in the RFP to do that. We are requiring a cover page. We also call that a solicitation request. It is not an affidavit. It does not require a notarized signature. It, again, is a form. It is a web form accessible to you through a link listed in the body of the RFP. You are going to complete that, and that is required. After you complete that, you are going to upload a single PDF of your entire application and attach it to the cover page. That will be the submission in its entirety. Okay, I'm going to go through the actual sections of what we're asking you to put together in the form of a narrative, budget, etc. In your narrative, you have a maximum of 25 pages. There's very prescribed formatting. Please take a look at that. Make sure you're adhering to what's given to you in the way of information in the RFP to package your request. I will tell you, focus on communicating in as concise and effective a way as is possible. Just because you're given 25 pages, please do not take the liberty to use them unless you're providing us with excellent information. We are looking at several things when we look at evaluating a narrative. We're looking at applicant capacity and experience. You have a maximum of 6 pages to talk about that. What makes your organization fit and prepared to address the objectives outlined in our new program? We ask you about what sectors you are going to be serving. The Director of Programs will talk about those more extensively in the information he provides. Why you intend or why you selected those sectors. And you have a maximum of 3 pages per sector selected. We are also asking you to give us demographic information about priority populations, where you're planning to do the work that you are explaining to us or defining or describing to us in the body of the narrative. There are links provided so that you can easily access demographic information specific to your particular service area. We also ask for information about an action plan. There is a timeline document that has been provided for your consideration. We want to know your proposed action plan, not just what you intend to do in the future, but what you're going to do to address work that is currently underway. That's very important. That is a maximum of 4 pages. Obviously, like every RFP in the application, we want to see a budget. We need you to tie the work that you propose to do to a budget and explain to us how much money do you need according to the funding table and the work that you plan on doing. We want it to make good sense like any grantor or funder would. So we have developed what we call Form 2, which is a tips and tools or resource document for people to use. It's actually resource document 3. You can take a look and see, get a little bit more information about how to put together a cohesive budget. Again, you need to package a fully executed non-acceptance of tobacco funds form. There are financial documents required as part of the application or request in response to the RFP. We will accept an audited financial statement. We will also accept information that documents that the applicant organization has 60 days of capital that will allow them to continue operating because TSET is a state agency and we pay on a reimbursement basis. There are also other attachments required. Those are very clearly outlined, and basically what they do is speak to the applicant organization's capacity to do the work that is specified in the goals in and around the RFP. All applicants are interested to know, once they submit applications, what do we do in evaluating the merits of those requests? We have protocols in place here at TSET to do that. All of these requests will go out to panels of external reviewers. We spend a lot of time and make a lot of effort to identify experts in the field that will comb through the request, looking at specific things to find the merits of those requests. So what they will be looking for, and what we are looking for internally, is capacity and leadership. And by that I mean, is your organization an established leader in addressing public health or public health related concerns, specifically tobacco control, physical activity and nutrition? And does the applicant organization have the capacity to do what we need, or to partner with us the way we need that organization to partner with us in meeting the stated goals of the RFP? Does the applicant organization have demonstrated partnerships and community investment? How you talk about that is very, very important. Who are you partnering with? Why is the partnership important? And what kind of a partnership is it? So they will be looking at that. The reviewers will also be taking a look at potential for impact. By that I mean, what are the demographics of your proposed service area? How do you plan to address those specific and unique needs? Also, they will take a look at the budget. Is it reasonable? Can you tie the requested amount to the work that the applicant organization proposes to do? There is a timeline in the body of the RFP document itself. I strongly encourage everyone to go through the timeline to look for key or important dates, because the last thing we want is to have someone miss an important deadline or forego participation in an applicant workshop if that's what they need. So take a look. That's close to the end of the RFP. In addition to timeline information, there is information, a very short section in the RFP about resources. Resource document 4 of the RFP outlines both state and national resources, so that when you are preparing to package your proposal, you have access to related information. So I strongly encourage you to take a look at that. That may be very useful to you. There is a sample terms and conditions document provided for review by all prospective applicants. I would strongly encourage you, if you're working, for instance, through a board-driven organization, to take a look at that and familiarize yourself, because that's sort of an outline of our expectations, so review it carefully. Any additional questions of any sort need to be submitted to me at kim.m@tset.ok.gov. We will get those, we will move through them, we will get together as a team, and we will make sure that the answers with the questions are uploaded to the website so all prospective applicants have access to the information at the same time. Thank you for joining us today, for taking your time to participate and viewing the information provided. It is absolutely our goal to provide you with exemplary customer service. If you do have questions, submit them again to kim.m@tset.ok.gov. We look forward to hearing from you.
Hello, it's good to be addressing you. I'm Jonas Mata. I serve as the Director of Programs. We will review the scope of work and the technical assistance and training support associated with the grant program. We will also address youth engagement, the role of youth engagement in the grant program. As you already know, TSET's goal is to reduce tobacco use and obesity. We intend to do this through a comprehensive approach that works across the 3 areas: tobacco control, physical activity, and nutrition. And we intend to do that through strategic interventions that focus on 4 community sectors. TSET also intends to fund 1 or more organizations in each county or consortium of counties to address tobacco control, physical activity, and nutrition in each of the sectors. The 4 sectors are businesses, which are non-governmental entities, community institutions and organizations, cities and government, and schools, and you will find the definition for each in the RFP. Organizations having the capacity and expertise to address all 4 sectors may do so in a comprehensive fashion, addressing each of the sectors. Applicant organizations may also decide to serve just 1 or more sectors. Regardless of the sectors that are served, the range of organizations and entities listed within the definition of each sector must be served. Grantees that are working the same service area must find a way to collaborate so that their efforts are coordinated, and all funded organizations must be willing to work with that particular organization that is working with the cities and government sector in an effort to leverage and then strengthen the impact of the local efforts. Funding amounts for this grant program are found in the Appendix 2, County Maximums, and there you'll find a county by county maximum funding level. We don't expect county staffs for the maximum. We expect organizations to ask for the amount of funding that they can reasonably and realistically spend. Outcomes to be achieved in each sector are found in Appendix 1, Outcomes by Sector. We established these outcomes after conducting national research around what other states were doing, what best practices recommend, and also through collaborative work with Change Lab Solutions, which is an agency that's done considerable work in this area. Each sector has 3 outcomes that are required, and there are additional outcomes that a grantee may choose to address if they decide to do so. Supporting the outcomes are playbooks and toolkits of strategies and interventions that will assist the grantee in achieving the outcome. The outcomes may change over time simply because best practices is evolving and around the area of tobacco control, physical activity, and nutrition. Healthy Living Program grantees will engage in interventions to do the following. Focus on changing policy, social norms, and the environment. They'll work on building existing resources and successes. They'll address the 3 areas: tobacco use, physical activity, and nutrition for those sectors that the grantee is funded to address. And then they will also be expected to mobilize the community in an effort to create and sustain opportunities for change. This grant program aims to implement population-based approaches. We have found that these work best, and certainly they're supported by the Center for Disease Control and Prevention and the Institute of Medicine. There's a strong emphasis on active and ongoing citizen involvement. Population-based approaches are really defined as working with a large population and changing systems. They're grounded in local assessments, looking at health data, looking at the county health improvement plans and other assessments that are done or are being done. And their emphasis really is on primary prevention and intervention with local organizations, community groups, systems, and families. This is a 5-year grant program. There's a startup and assessment phase that is flexible, 6 to 12 months in duration, depending on the capacity and the need of the grantee. And it culminates with the development of a work plan to carry out the efforts in the implementation phase. Technical assistance is available and will be provided, as well as training to the grantees as they move through this phase so they can create a work plan that they will implement. I would reference Resource Document 1 with regard to the timeline and some major events that are scheduled during the startup and assessment phase. The specific activities to be completed during the startup assessment phase would be to hire staff to run the grant program, participating in all the orientations, the technical assistance and training that will be provided by TSET, conducting the assessments, on the sectors which you've chosen to address, to develop the county-specific work plan, and then implementing an action plan of the current work you're doing in tobacco control, physical activity, and nutrition. So once the assessments are done, the grantee will then work toward, use those assessment findings to develop a multi-year plan to be implemented during the implementation phase. This grant program is considered a cooperative agreement among the grantees, TSET staff, and our technical assistance providers. TSET staff will certainly be involved significantly in the work that's done at the local level. There may be adjustments to work plans, budgets, etc., just based on the progress that's being completed or done at the local level. TSET staff will serve as the first point of contact for grantees and grantee-related activities. Another partner is the Center for the Advancement of Wellness at the State Department of Health, and they will be providing best practices and promising practices, technical assistance and training, and will serve as the hub of expertise there in that area. The Oklahoma Tobacco Research Center, in conjunction with Oklahoma State University, will serve as the external evaluators, and so they'll be developing the evaluation design for the entire grant program. They will also provide technical assistance to local grantees on evaluation issues that they may have. Supporting the grant program is the development of toolkits to assist grantees in addressing their strategies, such things as model policies, playbooks of interventions, toolkits, and then fact sheets. We also know that you have unique circumstances at the local level that you need to consider, and we would certainly urge you to be creative and innovative as you develop interventions that are based on the assessments that you've completed. It's important that you consider the local social, economic, and political characteristics, as well as the demographics and the populations that you have at the local level. During the first year of the grant program, TSET will engage grantees and partners in developing a youth engagement component for the grant program. Until then, existing youth teams such as SWAT, 4-H, Too Much to Lose, YMCAs or YWCA groups, or Boys and Girls Clubs may be used to assist the grant program. We prefer that grantees engage a small number of teams, quality teams, as opposed to having many teams. We also would say that there should be no new youth teams developed during the grant program, since we'll be working on developing that component with the grantees. So we've gone over the scope of work essentially, and the technical assistance and training support, as well as our thoughts about the role of youth engagement. If you have questions, we would ask you to email them to Kim McCoy at the email address that is on the screen. Thank you.